Hello everyone, my name is Benjamin and I will be conducting the team-oriented communication workshop today. I've been asked by our supervisor to share some of the tools that I gained in an interprofessionalism course in my undergraduate time. But before we begin, I do want to do a little bit of a participation exercise, which will help inform some later events in the presentation. So if you can type in the link at the bottom of the slide where it says https://tinyurl, if you can follow the link there on your cell phone, and it is okay to use your cell phone right now for this purpose, I've gotten approval. This is a completely anonymous survey. It's 6 questions, should just take you a little bit of time, and it will help us see how these tools can inform potential changes in our department specifically. So go ahead and fill that out and I'll be right back. All right, I want to thank you all for filling out that survey. I promise we'll reveal what that was about in just a few minutes. But as we come together, I do want to just highlight a few goals for this workshop. One being that we want to understand evidence-based practice for effective management of patient outcomes in a team-based care environment. Specifically, like, why is team-based care important to begin with? We want to identify strategies and barriers to effective teamwork, including some data that you guys have all just given us. And then we're going to identify some evidence-based communication strategies, specifically focusing on Team Steps, which is an AHRQ initiative. It's a joint program with the Department of Defense and AHRQ to standardize communication so that in tough situations, we all know what to expect from each other. So what is team-oriented communication and why is it important? The gold standard of patient-centered care these days is a team model, and it's really impossible for one provider to be able to address the complex needs of our patients. And one of the challenges of that is that we have to communicate with one another in order to be a team. And studies have shown that 70% of sentinel events occur when there's a breakdown in communication, and 75% of those events result in patient death. So communication failures are really the leading cause of inadvertent patient harm. And studies have shown that the use of standardized communication can improve these outcomes, which is why we're here today. In particular, AHRQ has found that tools like SBAR, which we're all familiar with, and closed loop communication, as well as some other tools we're going to address later, can actually reduce the number of sentinel events and improve patient outcomes overall. So from a bird's eye view, we want to look at strategies for team-oriented communication. This is really like what we need at the ground level to be a successful team. So some things that we might consider are, first of all, a group wants to establish shared goals and ground rules. If we don't do that, we end up in what's called a storming phase of group development forever, where people don't trust each other, they turn inward, or people become dominant, there's low morale, and ultimately productivity suffers, which means our patients don't get the care that we know that we can provide. Additionally, we want to find ways to get together with each other, so we want to schedule briefings, huddles, and debriefings, especially when situations are complicated, so that we can establish plans of care, who's going to take care of which aspects of the plans of care, and then talk about how it went and how we can do better in the future. Really, setting aside time for that is important. Teams should really strive to identify clear member roles. So which person is going to do task X, Y, and Z. And then understanding those things also allows anyone to step in if there's some overlap. But identifying clear roles from the beginning eliminates potential friction in the future. Having equality and the removal of hierarchy is something to advocate for within a team. Lateral power structures allow all people's ideas to come to the surface. Unfortunately, sometimes the best ideas stay quiet because people learn that staying quiet is a safe way to function in a team. And so if we can remove that power element and level the playing field, we can ultimately come to a better result. We want to respect the differences of team members. We all come from different backgrounds, and if we just establish that we're going to be different and we respect that, we're going to be on a much better footing to begin with. And then collaborating to prioritize and share decision making. So that means We want to work together on a plan, and we might have conflicting opinions on what to do first and second, but if we can figure out a way to compromise on those things and meet the patient's needs, then we're going to function as an effective team. All right, we pulled together the results from that poll and put it into a chart, so let's take a look at it. All right, it looks like we've got some good things going on here and some areas for improvement. Looks like members of the organization, so it looks like we can trust that the person next to us has a shared vision and mission, which is a good place. We're starting with that shared goal together. Looks like there's also some good morale and employee satisfaction, and it also looks like there is some trust. So good places to start. Definitely great for us to build on. The areas that scored lowest, so areas for improvement, looks like we can work on conflict resolution skills and ways to address disagreements that might be more respectful. It looks like communication might be better if it was more transparent, direct, and respectful. And teamwork and collaboration might be promoted in the workplace. So I'm highlighting here, it looks like the green areas we're going to take a look at later in this presentation. All right, based on the survey, it sounds like most people could agree that communication is an area for improvement. So let's talk about some tools. Things we already know, SBAR is really important for communicating critical information between nurses. We also use ISBAR with providers. Something that is within the ISBAR that maybe we don't recognize as a separate skill is something called checkback. This is basically when somebody gives you a piece of information, you repeat that information back to the person, and then the originator confirms that the information was transferred accurately. So in real life, in ISBAR, that's when you get an order for a medication from a doctor, you repeat it back to the doctor, and then the doctor confirms that it's correct. It can happen very quickly, but helps reduce errors immensely. Two other skills we're going to talk about are call out and handoff. These are going to sound like second nature to some people, but it's important that we identify them in case we want to kind of go back to basics in daily work and say, hey, let's call out the situation, or let's hand off here. So we have a common language and we know what to expect from each other in that exchange of information. Callout is another standardized communication tool we can use. This is something we might be familiar with in the code situation. It's very useful in emergencies and when information needs to be transferred to a lot of people at one time. The principle is closed loop communication to ensure that information is conveyed by a sender and is understood by the receiver as intended. So you can see on the right, there's an example of maybe a code conversation where one person is asking specific questions and there are people responding. It's important in this type of communication that you direct responsibility of tasks. So if you tell someone to do something, make sure you name them in that situation. We've all heard the term handoff before, but in this context, we're talking about a standardized form of communication. Handoffs occur when there's a transition of care. So when somebody, say, is transferring from units, when you're transferring responsibility among nursing assistants and nurses, physician assistants, patient transfers, any situation where you're handing a patient from one person to another. It's important the handoff also includes the opportunity for questions, clarification, and confirmation. So this is a key stage when you provide a lot of information about a patient. You can see on the right here is a form of communication called I pass the baton. This is a standardized form of information where you organize the report based on the criteria on the right. If we had more time, I would go into detail on this, but you can kind of get the idea. It's similar to SBAR, but more detailed, and specifically is used in a handoff situation. All right, we're gonna watch a video of an I pass the baton example. Pay attention to the end and the question she asks, and we'll talk about it briefly.
Hi, Carla. This is Liza Colby, one of the RNs down in recovery room, ready for report on Dr. Daniel's patient, Mrs. Angie Peters. Angie Peters, 54 years old, going to room 416, bed 2 on 4 East. Status post-total thyroidectomy this morning, doing well now. BP 120/85, Heart rate 80, temperature 37 degrees Celsius, O2 is up to 97% on 2 liters, and pain is 2 out of 10. Surgery was remarkable for a large thyroid, no pre-op issues. She's a Jehovah's Witness, so no blood products, but she is a full code. Her advanced directives are in the front of the chart. We have one safety concern, hypocalcemia. Dr. Daniels, the attending, ordered calcium levels Q12 hours because she's worried about possible hypocalcemia. So monitor pins and needles, muscle cramps, and shortness of breath. You'll need to review these symptoms when she's fully awake. Normal saline IV is running at 100 cc's per hour. Meds are metoprolol, 50 milligram prior to surgery, and we just gave her 4 milligrams of morphine. Urine output is good. Foley's to be DC'd in the morning. I'll let transport team know to ask for you. That is Carla Lopez, right? What else can I tell you? Yes, that's right. You've got all the information right. Good question. There are no known drug allergies.
So you'll notice a couple of things. She said, what else can I tell you? Which is a great way to add something to your workflow that really encourages this level of exchange. She encouraged the person and said, great question, when the receiver asked about drug allergies, and she used some check back as well. So this is a really good example of communication, maybe more ideal than what is achievable in the workplace, but maybe gives you some ideas about how to improve communication on the daily level. So inevitably, as we're working as a team, there's going to be conflicting opinions, conflicting points of view. Conflict is not something we should be afraid of. It's something that we should welcome because it means the team is trying to do its best. But there are some ways to be more constructive about it. One is to be offer criticism in a timely manner, so soon after you're addressing a specific or target behavior. It's also helpful that you use a respectful tone. Specifically, you want to focus on the behavior and not on the personal aspects of the situation. So if you have a personal problem with the person, really try to seat it in the facts, couch it in the patient's experience, and your safety concerns can be a really good way to do that. You want to make the criticism specific, related to a specific task or a specific behavior. You want it to be directed towards improvement. So you want to provide the direction on how something could be better in the future. And then you want to be considerate when you're approaching someone with criticism about how that's going to make them feel. And if you can do all those things, then the criticism is going to actually be more successful to begin with. So another way to manage conflict is the DESC script, DESC. DESC stands for describe, express, suggest, and consequences. Specifically, you want to describe the situation or behavior and provide concrete data. Be specific about what's wrong. Express how the situation makes you feel. Use I statements and say what your concerns are. And then begin to suggest other alternatives and seek agreement. That's another important piece. You want to try to agree on where you're coming from. And then finally, you want to outline what the consequences are. Specifically, how does this situation impact a team goal? If we all have a shared perspective and a shared goal, then conflict is inevitably going to stand in the way of that. And striving for consensus can be the ultimate outcome of the DESC script. So the last two strategies for addressing conflict we're going to talk about are CUS and the 2-challenge rule. Both of these strategies allow employees to be empowered to stop the line, which essentially means that we stop what we're doing until a consensus is reached. And we use these tools specifically when there's a safety concern. These are assertive statements that you make towards another individual. The CUS tool stands for concerned, uncomfortable, and safety. CUS. So if you're concerned about a situation, you start at a low level. You say to the person, I am concerned. You escalate to, I am uncomfortable. And if the person is still not responding and you feel like the safety issue has not been addressed, then you say, this is a safety issue, which signals to everyone in the room that we need to stop what we're doing and really figure out how to move forward. Another way to address a safety concern is the 2-challenge rule. So if you have a concern about the way something is being conducted, you can go to the person and specifically challenge it. You can offer your rationale. It can be very professional. Like, I think this is maybe not the best thing for the patient because they just told me that their daughter is on their way and the daughter really doesn't want them to have that treatment right now, so let's wait. And the person you're talking to maybe is very insistent on that happening. If you challenge something twice, the person who is being challenged has to acknowledge the concern has been heard. And if they continue to move forward with the situation, then the person who's expressing the concern needs to move up the chain of command. So these are really safety issues ways that we can address safety issues in our standardized communication. And if we all know that this is coming, then it might come off as less jarring if we know that this is just common language within our department that is rooted in patient safety. So I know we covered a lot of material in this, and this is really just meant to be an introduction to strategies and tools to improve communication in patient care. As we know, teams are an essential part of patient-centered care, and being a successful team member is ultimately going to benefit the patient. So if we can standardize our communication, we can help eliminate errors. But if we know it's coming and we know how a message is being packaged because we've all agreed that this is the method we're going to do it, then we can promote positive morale because we know what's coming. And we also know that the intent behind it isn't personal. It's about making sure that the patient is safe and getting the best care possible. And ultimately, managing conflict can be achieved in a professional and non-threatening manner by using this shared language because we know, again, the intent behind concern. So I hope you get something out of this. My hope is that you can come away from this presentation really thinking about ways to make communication your ally in effective team-based care and thinking about how communication can improve the lives of our patients.